The Prime Minister with ministerial arrangements.
Thank you, Mr Speaker. I inform the House that the Minister for Home Affairs will be absent from question time today, and the Attorney-General will answer questions on his behalf, and as well as on behalf of the Minister for Defence and on behalf of the Minister for Immigration, Citizenship, Migrant Services and Multicultural Affairs. The Minister for Population, Cities and Urban Infrastructure will be absent from question time today, and the Deputy Prime Minister will answer questions on his behalf. The Minister for Energy and Emissions Reduction will be absent from question time today, and the Treasurer will answer questions on his behalf. The Minister for Indigenous Australians will be absent from question time today, and the Minister for Health will answer questions on his behalf. The Minister for International Development and the Pacific and Assistant Defence Minister will be absent from question time today, and the Minister for Veterans Affairs will answer questions on his behalf. And the Minister for Regional Health, Regional Communications and Local Government will be absent from question time today, and the Minister for Communications will answer questions on his behalf.
I thank the Prime Minister. Questions without notice. The Leader of the Opposition.
Thanks, Mr Speaker. And my question is addressed to the Prime Minister. Can the Prime Minister confirm the number of COVID-19 cases in Australia is doubling every 3 days? And if this continues, the pressure on our health system will become enormous. Does the Prime Minister agree that our national objective must be to bring this outbreak under control, as South Korea has done?
The Prime Minister has the call.
Thank you, Mr Speaker. I can confirm, as I came into question time today, there are 1,609 confirmed cases in Australia. Sadly, there are 7 deaths. 91 persons have recovered from the coronavirus. I can confirm that the rate of escalation of those cases has been concerning, and that has been a keen focus of the AHPPC, the panel of medical experts that are reviewing this issue, as they have been every day since late January, and providing consistent advice about the measures that need to be taken, not just by the federal government but by state governments as well. And those governments have been taking those actions, as has the Commonwealth Government. Earlier today, I had the leadership meeting with the Prime Minister of Singapore, the annual Leaders' Dialogue between Singapore and Australia. That was done, and under these unusual circumstances, by telepresence. And at that, we actually signed the Digital Economy Agreement. I discussed with the Prime Minister of Singapore particularly a lot of the measures that they have been putting in place. The Leader of the Opposition makes reference to the work that's being done in South Korea. The work that's being done in Singapore has been a particular guide to the way that the Australian government, as well as the states and territories, have been looking to put measures in place. Those measures in Singapore include the fact that schools remain open in Singapore. And importantly, we had a discussion about how it was so important to ensure that I couldn't hear the Leader of the Opposition. No, I understand what the position is in Singapore. In Singapore, they have put a range of measures in place that mirror the sort of initiatives that Australia is seeking to put in place around the country. Our societies are different, our regulatory systems are different. It is very difficult to compare between countries. The data sets between countries is very different, but I do know that Australia's rate of testing is one of the highest in the world. The number of tests that we've undertaken, and we also have the lowest rate of positive testing in the world. So we have a very significant challenge. It is our goal, as both the Australian government and the state and territory governments, to ensure that we limit the spread of the virus through all the measures that are available to us, and to do so on the basis of the expert medical advice.
I call the member for Lindsay.
Thank you, Mr Speaker. My question is to the Prime Minister. Will the Prime Minister outline to the House how the Commonwealth Government is working to protect the health and well-being of Australians and their livelihoods from the coronavirus global pandemic crisis, and how the Commonwealth Government is ensuring that Australia is in the best possible position to emerge from this crisis?
The Prime Minister.
Thank you, Mr Speaker, and I thank the member for Lindsay for her question. And in relation to her last statement, as we have entered into this crisis, both a health crisis and an economic crisis, Australia has gone into this crisis with a very strong health system, with state and territory governments and Commonwealth governments that have balance sheets that are in a strong position to be able to deal with both the economic challenges that we face and providing important support to people right across the country, those who have lined up at Centrelink offices today, those who have communicated their intention to make claims in relation to the payments and various other supports and assistance that is there. But we have entered this crisis in one of the strongest positions in the world, both at a state level and at a Commonwealth level. As I just noted in response to the Leader of the Opposition's question, over 1,600 people have now contracted that virus, and that rate of increase has been escalating now for several weeks, in particular over the past week since COAG met in Sydney just over a week ago. I remember very well when the National Incident Response Room was set up on the 20th of January this year. The Deputy Prime Minister and I visited that centre just 2 days later, and that was the first of the many statements and initiatives that were put in place by the government to ensure that we're working to combat this virus as it would seek to take hold of our community. From that period of time, there have been numerous decisions, Mr Speaker, and those actions have encompassed our economic response, but most importantly, and first and foremost, the health response. That health response has been about ensuring that we're resourcing the needs that are there, both in our aged care system and our health system, some $3 billion in support, additional support that has gone into our health system to support our hospitals, to support primary care, to support our aged care facilities, our aged care workforce, our health workforce right across the country to ensure that they can meet the growing demands that will continue to present. We have also established the National Cabinet, that is a national cabinet of all Australian governments, to ensure wherever possible we can coordinate the actions of the national response between the actions of all Australian governments as they seek to put in place the measures that best address the issues in their states. The travel bans have been put in place. The strict social distancing measures have been put in place for large outdoor gatherings as well as enclosed gatherings, including those arrangements that I set out last night. The health system has received the additional support and will receive more. With the messaging regarding personal hygiene and social distancing has been conveyed to the public and will continue to be conveyed to the public. The economic stimulus package and the safety net package that we announced yesterday, Mr Speaker, is there to ensure that we can assist Australians get through this crisis. Of course we will be tested, and the Australian government will continue to take the actions that protect the lives and livelihoods of Australians.
The Leader of the Opposition.
Thanks, Mr Speaker. My question is again to the Prime Minister. What steps is the Prime Minister taking to improve the communication of measures related to the COVID-19 outbreak, including the rules on testing, advice to parents on school closures, and the difference between essential and non-essential activities?
The Prime Minister has the call.
Well, thank you, Mr Speaker. Some $30 million has been committed, and this was done several weeks ago, to support a public information campaign that particularly deals with the issues of healthy social distancing. And that campaign is in place, and that is being upgraded and expanded as required to deal with the very many messaging issues that it needs to be addressed. The Leader of the Opposition makes reference to a couple of issues, particularly in relation to schools. Let me be very clear. The health advice from medical experts that advise the National Cabinet is that schools should remain open. That is their advice. That has been their consistent advice. That advice has not changed from the AHPPC. And it is important that we all continue to act in accordance with that medical advice. In relation to the communication on the decisions that were undertaken last night and considered by the National Cabinet, they are being conveyed by the state and territory governments as they are putting the specific arrangements in place in each of their state and territory jurisdictions. The Leader of the Opposition makes reference to essential and non-essential. The essential activities were defined in relation to public gatherings, outdoor gatherings of 500 persons or more, and they were set out in the Victorian legislation, which was the model legislation that was being used by other states and territories, and those pieces, that information was communicated and set out last week. Last night there was very clear instructions about a specific list of indoor spaces that would not be continuing to allow gatherings past midday today, local time, in each of the state and territory jurisdictions. And states and territories are communicating with their industries and sectors, and the National Communications Campaign will continue to be updated to ensure that all of that information, including on the australia.gov.au website, which has all the most recent decisions, is there and available to the public.
And I call the member for Higgins.
Thank you, Mr Speaker. My question is to the Prime Minister. Will the Prime Minister outline to the House how a national cabinet has been brought together to focus and coordinate government resources and responses to the coronavirus global health pandemic so we can provide the best possible assistance to Australians during what is an unprecedented health and economic challenge? The
Prime Minister has the call.
Thank you, Mr Speaker, and I thank the member for Higgins for her question, and I also thank her for her counsel and advice with her background as a doctor, Mr Speaker, as there are many doctors in this place, and I'm sure we've turned to them on occasion, and I certainly appreciate the input I've received from the member for Higgins. For the first time ever in Australia's federal history, we established a national cabinet. That is a national cabinet of the governments of Australia, all states and territories, together with the Commonwealth, the leaders of each of those executive governments coming together to ensure there can be coordination between the executive decisions of those governments in terms of the national response to the coronavirus crisis. Now, those governments hold independent, individual sovereignty over the decisions that they hold under their various constitutions and subject only to the Constitution of the Commonwealth of Australia. But this mechanism has proved to be very effective in drawing together the many issues that the state and territory governments, together with the Commonwealth, need to address to ensure consistency wherever possible. The National Cabinet has met on 4 occasions in just the past 10 days. It meets even more urgently as required based on consultation with the members of the National Cabinet. They have activated the second stage of the Australian Health Sector Emergency Response Plan for the coronavirus. They have banned non-essential mass gatherings of more than 500 people from Monday the 16th of March. Travel restrictions on cruise ships destined for Australia's borders commenced on the 13th of March for cruise ships from foreign ports. Universal self-isolation requirement on all international arrivals was effective from the Sunday 15th of March. They endorsed the medical expert panel advice, the AHPPC advice, against the bulk purchase of foods, medicines and other goods. They endorsed the Commonwealth's decision to close Australia's borders to non-citizens and non-residents on 9 p.m. Australian Eastern Daylight Savings Time on Friday 20th of March. That followed on from the earlier travel bans that the Commonwealth put in place prior to the formation of the National Cabinet. Non-essential indoor gatherings of greater than 100 people have not been permitted since Wednesday 18th of March, and a 4 square metre rule as a guideline was put in place on the 20th of March. Further announcements were made on those indoor gatherings last night on the basis of the National Cabinet meeting last night. Domestic travel, all Australians should only consider travelling when it is essential, and if people are unwell they must stay at home unless seeking medical care. Aged care facilities, enabling consistent public health directions on visitor restrictions to complement regulatory standards that were adopted by the Commonwealth. Those restrictions have been implemented through both the work of the Commonwealth Government, through our accreditation processes, as well as public orders provided by the state governments. And of course, Stage 1 restrictions were put in place last night on the 23rd of March, which relate to many places of social gathering, pubs, registered and licensed clubs, gyms and indoor sporting venues, cinemas, entertainment venues, casinos and nightclubs, restaurants and cafes being restricted to takeaway and home delivery, and religious gatherings and places of worship. Mr Speaker, as the number of cases grow, the National Cabinet will continue to take the decisions based on the expert medical advice that we're receiving on a daily basis.
The member for McMahon.
Thanks, Mr Speaker. My question is to the Prime Minister. I refer to the government's expansion of Medicare telehealth rebates to some patients and services. Will the government expand telehealth rebates to all patients and services so that Australians don't have to visit a health provider during this crisis when it's not absolutely necessary? In particular, will the Prime Minister agree to expand telehealth rebates to mental health services and also provide mental health screening to people affected by COVID-19 and ensure dedicated services for children, parents and health workers?
The Minister for Health.
Thank you very much, Mr Speaker, and I want to thank the opposition spokesperson for this question, and the answer is yes, we will be taking those steps. We have shortly before question time announced the 3rd stage of our telehealth expansion. The first stage of telehealth expansion was announced with the initial package of activities with regards to the $2.4 billion of health activities, and that in particular provided telehealth to those who were in isolation or seeking diagnosis for coronavirus, but also to vulnerable groups who were not within those areas. The second stage, which was commenced on March the 16th, was an expansion of telehealth items for midwives and recognises a general practice for continuity of care practices, which meant a broader access for people who were otherwise vulnerable. And then today, in a joint statement with the Royal Australian College of General Practitioners and the Australian Medical Association, but also worked in conjunction with the Australian College of Rural Medicine, ACRM, and the RDAA, the Rural Doctors Association of Australia. We announced a further expansion of telehealth. That expansion of telehealth now allows all doctors and medical practitioners who are vulnerable to be able to practice from home. As part of that, we have announced that we will be moving to and designing a Stage 4. The medical practitioners were very, very, very clear that they wanted to design this carefully and in a staged capacity. That Stage 4 is a whole-of-population access to telehealth. The reason it's being done in a staged capacity is twofold. One is there is a very important need to maintain face-to-face services, whether it is for conditions which might be cardiac, whether it is for conditions which might involve musculoskeletal challenges, whether it's for conditions which might involve diagnoses through the ability to actually test and feel and see a patient's condition. All of these were identified as, by the medical practitioners as a critical step forward. But that face-to-face is Stage 4 for the whole of population. That telehealth for the whole of population is now being designed in conjunction with those groups I've just outlined. It's being led by Professor Michael Kidd, who's working with the government. We have now had over 100,000 telehealth services provided, and they are continuing at well over 20,000 a day. And Stage 4 will allow that to be provided on a whole-of-population basis. The other thing we wanted to do is make sure that smaller general practices were protected, which was a specific request. All of these elements are part of the current design.
And the member for McMahon, just on indulgence.
Thank you. On indulgence, Mr Speaker. Can I thank the Minister for his answer and acknowledge the announcement that he's made? It was a suggestion made by the opposition in good faith. We are very pleased that the Minister has taken it up. It's been based on very strong feedback from GPs and allied healthcare professionals, and also in relation to mental health. I completely understand the government's focus on physical health, but we all need to collectively turn our attention we all need to turn our attention to the mental health of Australians as we get through this crisis. I thank the Minister for his response.
And I call the Leader of the Greens.
Thank you, Speaker. And my question is to the Prime Minister. A key factor in who will live and who will die from the coronavirus is the number of intensive care beds, especially the number of ventilators. Prime Minister, do you have a plan to at least double the number of intensive care units and secure the ventilators we need? And if there is such a plan, when will this goal be achieved?
The Prime Minister.
Thank you. I'll make a brief comment and pass on to the Minister for Health. The modelling work that is being done to provide advice to the government and to the other Australian governments is to ensure that we seek to manage the spread of this virus in such a way as that it will avoid what would otherwise be quite intensive peak demands. I think we all understand that. So the first line of attack in this is the social distancing and other measures that will significantly alleviate the pressure on the health system. And that is the first thing we need to do. But what we've done in putting those modelling processes together is to look at the potential impact on what the effect will be on those intensive care units, but also emergency departments and other parts of the health system. And that will mean ensuring that we maintain medical supplies, and we also manage the health workforce within the hospitals that can best ensure that those beds and services are there when they need it. We, at this point, have a very low number of patients that are actually in ICU, but of course we expect that to change as things change with the spread of the virus in the future. But I'll ask the Health Minister to add further on respirators and other matters of that nature.
The Minister for Health.
Thank you very much, Prime Minister, and also to the member for Melbourne. As the Prime Minister said, there are two parts to the strategy. One is to reduce the demand, or to flatten the curve, as is now a phrase that is all too sadly familiar to Australians as well as everybody in this chamber. That's about reducing the number of people who contract coronavirus and spreading the load whilst protecting the vulnerable. At the same time, since the very earliest times, when the Chief Medical Officer declared this to be a disease of human pandemic potential on the 21st of January, he and the state Chief Health Officers, the state ministers, and I want to thank all of the state ministers, their health services are doing an extraordinary job. I particularly want to thank New South Wales Health and the New South Wales Minister, Brad Hazzard. They have borne the brunt of this and they have done a Herculean job. And all of the leaders have been focusing on this. It's been one of the key elements, and normally we wouldn't say this, in the National Security Committee requests that the Prime Minister has made to compare peak demand with peak supply. We are seeking to double the capacity of intensive care units, if not more, including ventilators. I can inform the House that there has been a major order for an extra 1,000 ventilators, what are called invasive ventilators, placed with ResMed. Non-invasive ventilators are now being determined by the AHPPC requirements, and 4 firms have stepped in to help with production: ResMed, GE, Philips, Medtronic. They are showing a spirit which is beyond what any of us could have hoped. We thank them, we honour them, we will work with them.
And I call the member for Goldstein.
Thank you, Speaker. Speaker, my question is for the Minister for Health. Will the Minister update the House on the spread of coronavirus in Australia and the latest advice to Australia from medical experts?
The Minister for Health has the call.
Thank you very much, Mr Speaker, and I want to thank the member for Goldstein. I particularly want to acknowledge what he has done in his community, as many members on all sides of this chamber have done, in helping to bring their communities together in programs such as supporting seniors and others who are isolated, building volunteer programs. It's something that each and every one of us can do in our own communities. I know my own Mornington Shire, under the leadership of Mayor Sam Hearn, have done a similar thing. So I just wanted to acknowledge that example, but I know that there are people on all sides of the chamber doing a similar thing. In terms of the situation, as the Prime Minister set out, there are now over 1,600 cases informed to us by the National Incident Centre just prior to coming here today, and very significantly 135,000 tests have been carried out. That number will increase as the course of the day goes on. That is one of the highest actual numbers in the world. It's also one of the highest per capita numbers, now over 0.5% of the population. But with of the available data we have seen, one of, if not the lowest, positive rates. What does that actually mean? It means that we are testing broadly and more widely than almost anybody else, and therefore picking up cases. That's an extremely important thing, and that's why in the advice that the AHPPC, or the medical expert panel to which the Prime Minister referred previously, put out last night, what they said is that the situation with our first 1,000 cases is somewhat different to that of other countries, such as Italy and the USA, when they were at 1,000. They then set out what was the case with regards to the sad and tragic loss of life, where it was much higher in other countries than it has been in Australia. The latest advice is 7 lives lost, sadly. But interestingly, they go on to say that we have one of the lowest COVID-19 test positivity rates in the world, approximately 1%, compared to the USA of 13%, the UK of 5%, and even the Republic of Korea, or South Korea, at 3%. Most interestingly, there have been at this stage, on the last advice that I have, and it may have changed, less than 20 cases that have been to ICU. That's a very important sign. What that says is that our actual recognition of cases is much more accurate than many other comparable countries, and that's shown by the level of lives lost relative to the first 1,000 and the level of ICU cases, both of which are far lower than the rest of the world. Against that background, the steps that we are taking, as we've said, ventilators, the work on testing, the work on preparation of ICUs, all of these things are being done through a combination, which I may have a chance to explore later, of primary care, aged care, hospitals and research. It's a comprehensive program. Yes, it's moving. but I must say a special thanks to all of our health workers who are our real heroes around the country.
And I call the member for Macarthur.
Thank you, Mr Speaker. My question is to the Prime Minister. Frontline health, aged care and home care workers have said that Australia's response to COVID-19 has been undermined by shortages of personal protective equipment such as masks and gowns. What is the government doing to address this urgent shortage?
The Prime Minister.
Thank you, Mr Speaker, and I thank the member for his question. This is one of the key issues the government has been working on now for many months to ensure that those supplies are in place. That also means managing the demand for those supplies, whether it's in the dental sector or even how those PPE equipment are being provided in particular contexts. It's being provided in the most urgent of cases. One of the most important discussions we had recently at the National Cabinet was how elective surgery was being managed, because that also has a big draw on that type of equipment, as you would know. And so I welcome the decisions like in Western Australia, for example, where they're confining elective surgery to stage 1 and urgent stage 2, and that is being practiced, I understand, now around all states and territories. So again, this is as much about managing demand as it is ensuring supply, but I will ask the Minister for Health to add to this answer, and the Minister for Industry may also wish to answer that as well, because she has been working to ensure a domestic supply to increase our capacity to produce that equipment here in Australia as well, and that has included the support of the Australian Defence Forces.
The Minister for Health.
Thank you very much, Prime Minister, and I acknowledge the history and service of the member for Macarthur. To date, more than 3.1 million masks have been deployed from the National Medical Stockpile. This includes to primary health networks, to general practices, to community pharmacies, to Aboriginal community-controlled and health organisations, to state health authorities, and additional distributions are planned this week. We have had significant supplies arrive over the weekend, and we have over 300 million masks on order. I do want to be honest. There has been some practice at some borders where some countries or individuals have diverted at the last minute some of those supplies. It is a difficult world out there, and we are doing everything we can to make sure that those masks that are ordered are arriving. But those orders are very significant, but they are being distributed as they arrive. We do have supplies which are being shared out with dentists and others. The supplies are being managed very carefully by the National Medical Stockpile, and they are triaging and prioritising. And I thank again the health workers. One of the significant things we are doing is the extraordinary domestic production which is now being ramped up, and I'll refer to the Minister for Industry.
The Minister for Industry.
Thank you, Mr Speaker. And if I could add to the responses already given by the Prime Minister and the Minister for Health, we are working very closely with manufacturers right across Australia for them to either ramp up their production or to change their manufacturing processes so that they can produce the PPE that is needed. That includes things such as gloves, gowns, masks, critical pieces of infrastructure and supply that's needed, which includes ventilators, understanding that that has already been touched on. Happy to add to it later.
The member for Chisholm.
Thank you, Mr Speaker. My question is to the Minister for Health. Will the Minister outline to the House what actions the Morrison government is taking to respond to the serious challenge of the coronavirus?
The Minister for Health.
I want to thank the member for Chisholm. Many members in this House have faced many pressures over the course of the last 2 months. Few have faced more pressures than the member for Chisholm. In the earliest days of this outbreak, when the borders were closed with China, perhaps before almost any other significant country, she, along with others, fielded many of the questions and the pressures that particularly fell upon the Chinese community, and she managed that with great grace and dignity and effectiveness. Now, our overall plan is built around 4 pillars. Firstly, primary care. Secondly, aged care. Thirdly, hospitals. Fourthly, vaccines and medical research. That's underpinned by the work in relation to critical supplies, which has been addressed during the course of today. In relation to primary care, We have focused, as I said, on telehealth earlier. Those facilities are now being ramped up to stage 3, and as I've indicated, we will work to a whole-of-population plan in conjunction with the medical authorities and representatives over the course of the coming days, with more than 100,000 services having been provided. In relation to testing, this has been one of our most important elements. There was a global supply of test kits. We now have a significant number of test kits, more than 1.5 million test kits on order, I can now inform the House, of different forms. And we have had a series of different approvals provided by the TGA over the course of the weekend for different types of what are called point-of-care tests. And so these will include different types of finger prick tests, and significant orders have been made. We also have the work on preparation for Indigenous communities. I particularly want to focus on aged care. More than $500 million all up, with an initial $100 million and then an over $440 million package have been provided. This is really looking at 3 elements in relation to aged care. The first $100 million was about emergency support in cases such as Dorothy Henderson Lodge. The additional funding then goes to ensuring that we have retention of current staff. So there will be a significant staff bonus, which will amount to approximately $800 per quarter for full-time equivalent residential care staff, and $600 per quarter for full-time equivalent home care staff. And then we have funds for extra staff and other costs which will be required by aged care facilities. So we recognise that the pressures on those facilities are great. This is where our most vulnerable are, and we have seen with the Dorothy Henderson Lodge the tragic consequences if the infections are allowed in. And so in preparing them, in preparing the hospitals, as I mentioned earlier, and the research, we're taking a comprehensive approach.
The member for Ballarat.
Thank you, Mr Speaker. My question is to the Prime Minister. Who is responsible for allowing passengers to disembark the Ruby Princess cruise ship, many of whom are now presenting with coronavirus symptoms? Why isn't Australia taking the temperature of all international passengers on arrival at our airports and ships terminals still today?
The Prime Minister has the call.
Thank you, Mr Speaker. Upon arrival in Sydney on the 19th of March and following Immigration and Customs clearance, the vessel was placed under the control of the New South Wales authorities, including New South Wales Health and the New South Wales Port Authority, who lead the human quarantine process. Australian government quarantine and self-isolation requirements were communicated through announcements, and fact sheets and declaration cards were required for all crew and passengers. I would remind all passengers from the Ruby Princess that they need to self-isolate for 14 days, like all travellers arriving from overseas. And I note that New South Wales Health has stated that it undertook a full assessment of the Ruby Princess and allowed the passengers to disembark. The Chief Health Officer of New South Wales said this was considered a low risk given that it is transported between Sydney and New Zealand. I'd also note that yesterday the Australian Defence Force was provided assistance to the New South Wales Health Department to provide contact tracing support with a team to undertake contact tracing activities, including relating to passengers from this vessel. In relation to the broader measures of screening at airports, the screening arrangements that have been put in place have targeted high-risk countries, and that has been done on the advice of the AHPPC.
The member for Fisher.
Thank you, Mr Speaker. My question is to the Treasurer. Will the Treasurer update the House on what action the Morrison government is taking to support Australian households, including casuals, sole traders, retirees and those on income support during the coronavirus pandemic?
The Treasurer has the call.
Well, thank you, Mr Speaker, and I thank the member for Fisher for his question and acknowledge with his background in business his focus on ensuring that his constituents and indeed the people of Australia can continue to stay in a job and businesses to stay in business. Now, Mr Speaker, the economic environment, both domestically and internationally, has deteriorated. We expect that the economic shock from the coronavirus will be deeper, will be wider and will be longer. And as a result, today we introduced into this parliament a series of bills
which represent the most significant support for the Australian community and economy outside of wartime. Mr Speaker, $189 billion of support is being injected into the Australian economy in just the last 10 days in terms of announcements. We've partnered with the Reserve Bank of Australia. We're working closely with the commercial banks of Australia to support their customers. And of course, we have had our first stimulus package and our second package, which has been designed to support the Australian people by cushioning the blow, particularly for those who have seen their income being reduced, their hours being reduced, or being stood down, or indeed being unemployed. Now, Mr Speaker, this is very much a Team Australia moment for everyone to come together for the same end. In terms of the specific measures that we have announced, there's a $550 coronavirus supplement, which effectively doubles what was known as New Start and now known as the Job Seeker payment. There's a second $750 payment, which will go to more than 5 million Australians. The first payment, which will go from the 31st of March, is going to 6.5 million Australians. People on a carer's payment, people on family tax benefits, people on a Commonwealth Seniors Health Card, people on a disability support pension, indeed more than 2 million people on a pension will be receiving these $750 payments. Mr Speaker, we've also changed the deeming rates, and that is important because obviously many pensioners are affected by that. We've also changing the drawdown rates by halving them, as those opposite did during the GFC, to make it easier for retirees to control their own savings and their own super. And we're providing early access to superannuation for people who have been impacted by the coronavirus. That is very significant because that is the people's own money. $10,000 this year, $10,000 next year, which will help cushion the blow together with our other measures.
The member for Rankin.
Thanks very much, Mr Speaker. My question is to the Prime Minister. What are Treasury's forecasts for the impact of COVID-19 on the economy, including on growth, jobs and businesses?
The Treasurer.
Thank you, Mr Speaker. Well, Treasury believe that the measures that we've introduced will add about equivalent of about 5%, they're worth about 5% of GDP in the June quarter, around 7% of GDP in the September quarter. When it comes to growth, Treasury believe that in terms of the June quarter, it could add up to 2.75%, and in terms of September, could add up to 3.25%. Now, that doesn't take into account the obvious negative impact of the coronavirus, but in costing the coronavirus supplement, Treasury estimate that up to 1 million people, in addition to those who are already on New Start, could be accessing this new coronavirus supplement. That's a lot of people, but not every one of those people are actually on the job and unemployed, because that could mean if you're a sole trader, if you're someone who's a casual who's had reduced hours, you can still access this new coronavirus supplement but not effectively be unemployed. That's what Treasury's work has been undertaken. It's obviously a very difficult situation to predict. Treasury themselves, as the member for Rankin would be aware, have said that producing forecasts and estimates in this environment, just as the Reserve Bank have said, is very, very difficult. But that's their best, the best estimates about some of the numbers that are involved in our costings.
The member for Nichols.
Thank you very much, Speaker. My question is to the Deputy Prime Minister, Minister for Infrastructure, Transport and Regional Development. Will the Deputy Prime Minister inform the House how the Morrison-McCormack government is ensuring that freight and logistics supply chains continue to deliver food and supplies around Australia during this challenging time?
The Deputy Prime Minister has the call.
Thank you, Mr Speaker, and I thank the member for Nichols for his question. Mr Speaker, he represents towns such as Seymour, Shepparton, Yarrawonga, Echuca and Cobram. They all fit very neatly into the supply chain. They produce a lot of food in the electorate of Nichols. And, Mr Speaker, if every Murrumbidgee irrigation area farmer produces enough food to feed 450 foreigners and 150 Australians each year, there'd be no different in the member for Nichols electorate. They're fine people and we thank them for the work that they do. Australians, as we all know, Mr Speaker, are resilient people. They will get through this together. We will get through this together. This government is working hard every single day, every single night, to make sure we get through this unprecedented time, this time of crisis. And while restrictions on the movement and association of people are necessary, I want to reassure Australians that logistics and supply chains remain in place. There will be no shortage of food for families over coming months. Just look at the facts. Our agriculture sector is a net exporter, producing enough food for 75 million people. There's more than enough to go around. Our supply chain, farm gate to plate, is effective, it's efficient and it will continue to deliver. It will not let Australians down. The heartbeat of our nation, our truckies, they will continue to deliver food and other necessary supplies to the supermarkets. I will add in there too our train drivers. Rail will play its part too, of course. There is just no need to hoard food, to raid regional supermarkets. It is not on. It has to stop. People have to desist from doing this. We will not run out of food. And to help make sure that I've been chairing regular teleconferences of State Transport and Infrastructure Council members. We've liaised with the Shadow Minister, the member for Ballarat. We've talked to key stakeholders. We will get through this, as I say again, Mr Speaker, we will get through this together. We're working to ensure that freight and logistics supply chains remain sound and continue to operate effectively. Freight and logistics are critical to this nation, and particularly, as the member for Nichols well knows, to the regions. The aviation sector, Mr Speaker, of course, is already experiencing considerable downturns, with most airlines operating drastically reduced services. In addition to the $1,715 million aviation package to provide a range of relief from taxes and charges, the government is working very closely, very cooperatively with the airlines to make sure they will be in a position to get people moving again once the travel restrictions are lifted. The airline sector is crucial and will continue to do everything that we can to ensure they survive. And of course, as well as our various economic actions to back regional Australians, their jobs and to keep small business doors open, the government has set aside $1 billion for the regions, communities and industry sectors to ensure that those most impacted by the coronavirus will receive the help they deserve and they need.
The Leader of the Opposition.
Thank you very much, Mr Speaker. My question is addressed to the Prime Minister. According to the government's proposed legislation before the House, the coronavirus supplement will not begin until 27 April. Most people won't receive the first payment to households until April or the second payment until July. Pensioners won't see a boost in their income due to the change in deeming rates until 1 May, and employers won't receive a cash flow boost until 28 April. When we all agree that the economy needs immediate support, why will these payments take so long to start?
The Prime Minister has the call.
Thank you, Mr Speaker, and I thank the member for his question. The packages of measures are dealing with different challenges. When it comes to those who are on fixed incomes, obviously through benefit payments and things of that nature, their incomes are not being directly affected because they are on those fixed income payments. And the payments that the member refers to, the $750 payments, they are coming in both April and they are coming in July. They will continue to receive all the other income at the same levels they have been receiving it, and that will provide a pulse support to those individuals at that time on those two occasions, because, as I've said at length, we need to be in a position to not just do this now, but to continue to do it for at least the next 6 months, and if we have to extend these measures further, then of course we will. One of the other important principles we have applied as we have put these various packages of assistance together is that we have ensured that we have sought to use existing payment mechanisms both in the tax system and in the payment system. The Leader of Opposition may be aware that the redesigning of major payment systems would only add even further delay to the processes of getting additional payments out to beneficiary recipients. So working through the payment systems that we have, it enables us to get these payments to Australians in the most effective way possible. I note that in overseas jurisdictions where they are not following these principles and they are designing new schemes, then that provides further complication in setting up payment systems, which means those payments are much even further away, Mr Speaker. So our Department of Government Services will be working night and day and taking on some additional 3,000 staff to ensure that they can meet the timing requirements, and if it can be done more quickly than that in the turnaround of these arrangements, I have no doubt it will be done. But the public servants who particularly are here in the ACT are doing an outstanding job in turning around these measures. Those public service members are out there doing that job, working late into the night to ensure they can turn this round as quickly as possible. They're the ones who are on the phones taking the many calls from distressed Australians. They're the ones who are redesigning systems. They're the ones who are at Centrelink offices, and they are doing a fantastic job, and we will continue to support them to do that job as effectively as they can and with the additional resources they need to turn around this support as fast as we can provide it.
The member for Longman.
Thank you, Mr Speaker. My question is to the Treasurer. Will the Treasurer update the House on what the Morrison government is doing to provide regulatory protection and financial support to help small businesses stay in business during this challenging time?
The Treasurer has the call.
Thank you, Mr Speaker, and I thank the member for Longman for his question and his support for the government's efforts to ensure that Australians can remain in a job and businesses to remain in business. And our stimulus package number 1 and our second package, which is designed to cushion the blow and enhance the safety net, have been involving measures that are targeted, that are temporary, that are scalable, and that, as the Prime Minister said, using our existing tax and transfer system. And I want to put on the record my appreciation to the Department of Treasury and the Secretary for their close help and assistance and outstanding work, and of course Finance, in preparing this package. The Treasury and Finance have done a wonderful job. Now, Mr Speaker, we have focused on supporting small and medium-sized businesses to keep people employed. 3 out of every $4 that we spent in the first stimulus package was designed to supporting small business. Now, the number of important measures that we have announced, measures like expanding and extending the instant asset write-off and accelerated depreciation. In terms of the instant asset write-off, we've taken it from companies who have a turnover up to $50 million and extended it to companies with a turnover of up to $500 million. We've taken it for purchases at $30,000 and extended it out to purchases for $150,000. When it comes to the 50% accelerated depreciation, we've also extended that out to companies with a turnover up to $500 million and out to June 2021, Mr Speaker. Other initiatives that we've undertaken include a 50% wage subsidy for employers who have apprentices. 117,000 apprentices. Whether you're a carpenter or a plumber or a mechanic or a hairdresser, people who are employing these apprentices, it'll be easier for them to keep them on in work despite the difficult times because of the wage subsidy. Our other support through the cash flow system, through the tax system, providing cash flow support is absolutely critical for 690,000 small and medium-sized businesses and 30,000 not-for-profits. This is a $32 billion measure that we have announced, from a minimum of $20,000 up to a maximum of $100,000 payments, cash payments to small and medium-sized businesses. The work that we have done with the banks to ensure that there are no interest payments or principal payments for small business on loans for 6 months, which will be an important lifeline. The fact that we're co-guaranteeing with the banks and other lenders loans that are up to $250,000 for 3 years with no payments in the first 6 months is extremely important, as well as the regulatory changes around insolvency and bankruptcy laws to ensure that businesses can trade through this difficult time. We are standing with small and medium-sized business operators through this very difficult time, and all their employees.
The Prime Minister is just seeking
Just
indulgence.
to add to an answer that I just gave, it is actually 5,000 additional staff that we're putting on in the government services and related areas to deal with the workload. The earlier number related to the earlier package we were working on, and the second package upgraded that amount to 5,000.
I thank the Prime Minister. The Manager of Opposition Business has the call.
Thanks, Speaker. My question is to the Prime Minister. Can the Prime Minister confirm that under the business cash flow measure, businesses will be paid based on their staffing levels in the first quarter of this year, not on how many staff they have kept on through the crisis? Doesn't that mean that employers who stand down staff will receive the same assistance as employers who keep people in work?
The Treasurer.
I can actually confirm to the House that the wages bill, which is assessed based on the tax withheld, will count in terms of all the way up to the June the 30th, in both for quarterly as well as monthly BAS payments. Now, of course, it depends on how much the particular business will receive, depending on the size of its wages bill, and of course there are going to be individual circumstances. But for a quarterly payer, the wages bill up to and including June the 30th is relevant to how much that business will receive, whether they receive the minimum of $20,000 or up to $100,000. So, Mr Speaker, there is an alignment of interests between the employer here and the employee. Small and medium-sized businesses are doing it tough, and they want to keep on their employees as much as possible. They also have other expenses, as the honourable member would understand. But what is relevant to the assessment of how much a business gets can be all the way up to June the 30th in relation to their particular BAS statements.
I call the member for Boothby.
Thank you, Mr Speaker. My question is to the Minister for the National Disability Insurance Scheme and Minister for Government Services. Will the Minister outline to the House how the Morrison government is supporting Australians, including vulnerable Australians, who are being impacted by the economic downturn caused by the coronavirus?
The Minister for National Disability Insurance Scheme and Minister for Government Services.
Let me thank the member for Boothby for her question. And building on what the Prime Minister has said, the government's establishing a new time-limited coronavirus supplement to be paid at the rate of $5.50 per fortnight. This means anyone eligible for the maximum job seeker payment will now receive more than $1,100 a fortnight, effectively doubling the payment for the next 6 months. This will be paid to both existing and new recipients of the job seeker payment, youth allowance, other parenting payment, farm household allowance and special benefit. Eligible income support recipients will receive the full amount of the $550 coronavirus supplement on top of their payment each fortnight. We're also waiving the 1-week ordinary waiting period, the liquid asset waiting period and the newly arrived resident waiting period. In addition, there are a range of other supplements that are triggered when someone gains access to the job seeker payment. This includes the energy supplement, pharmaceutical allowance and, of course, Commonwealth rent assessments, which is paid up to $139 for singles and more for families. The government also provides family tax benefit A and B, which potentially puts hundreds of dollars more per week into the pocket of those families to help cushion the blow in this difficult time. On Sunday, the Prime Minister further announced $750 payments will be made to Australians on income support who are not eligible for this coronavirus supplement. This includes those receiving the aged parent, pension, carers allowance, family tax benefits, disability support pensioners, veterans income support recipients, student payment recipients and eligible concession card holders. For those eligible, this payment is in addition to the $750 stimulus payment announced on the 12th of March. It will automatically be paid from July the 13th to about 5 million Australians. Half of those that will benefit are on the age pension. The first payment, or the first $750 payment, will be paid from March 31 to people who have been on one of the eligible payments any time between March the 12th and April the 13th. We've also announced a further reduction in the deeming rate of 25 basis points to reflect the latest rate reductions by the RBA. And as of the 1st of May, the lower deeming rate will be 0.25%, the upper deeming rate 2.25%. This will benefit about 900,000 income support recipients, including aged pensioners. I want to assure all Australians that the Morrison government is absolutely committed to supporting everyone through some very difficult months ahead, so that we can bounce back as a nation a lot stronger than ever before.
The Leader of the Opposition.
Thank you, Mr Speaker. My question is also to the Minister for Government Services, and I refer to the fact that the MyGov website crashed shortly before 9 a.m. this morning. Was this because the site only permits a limited number of people to access the site at once and was simply overwhelmed, or was there another reason? When will the delays be over?
The Minister for Government Services has the call.
Yes, let me thank the Leader of the Opposition for his question. Advice to me this morning was that MyGov attracted 95,000 concurrent users. at 9:40 a.m. that triggered the DDoS alarms, denial of service attack alarms going off, and slowed the system. The system had been designed for 55,000 concurrent users, so was overloaded by hitching 98,000. 55,000 is the maximum number. It was doing 6,500 users last week. We are currently looking at how we expand the 55,000 concurrent users to a stronger basis. I've also asked the department to investigate the DDoS alarm triggering, and the advice to me is as following. Our systems have had multiple and sustained denial of service attacks over the past few weeks. The network alert status is now at high. This, combined with all of the data that the 98 or 95,000 users, gave rise to a very strained performance because of the high number of usage, and that caused the outage. The DDoS alarms show no evidence of a specific attack today. That doesn't. The advice here doesn't mean there is no need for heightened cyber security. We do need to remind all of our clients that, unfortunately, nefarious actors will use the current situation to their advantage, and we have seen the ACSC put out advisory notices about things today.
The member for Ford.
My question is to the Attorney-General and Minister for Industrial Relations. Will the Attorney-General update the House on how the Morrison government is working with employers and employees, as well as their representatives, to provide certainty about workplace rights and entitlements as we tackle the impacts of coronavirus?
The Attorney-General and Minister for Industrial Relations.
Thank you, Mr Speaker, and I thank the member for his question. I think probably the coarsest but most accurate summary I can give of the challenges that we're facing are, one, around information and two, around flexibility. Information is becoming absolutely critical, and the flows of information that will allow employers and employees to make the best decisions are becoming absolutely critical. The issue of flexibility, if we can get that right, could make a profound difference to the number of jobs that we can save through this, and it's a matter that we can work on a bipartisan basis. With respect to the information, as soon as we realised that this was going to cause enormous disruptions in the IR space, we dedicated a guidance page on the Fair Work Ombudsman website, which is interactive to the extent that it learns from itself. So information comes out about situations that were merely hypothetical weeks ago, and the advice is refined all the time in a general sense. That has had over 500,000 visits since we established it, which goes to show the level of information exchange and how critical it is. There's a direct advice line, 131394, with the Fair Work Ombudsman. That's had very recently a 250% increase in the number of calls coming in. The information that's going out, I think, is high standard and accurate, but we're improving it all the time. We also, at the suggestion of one of the meetings that I had with employer and employee organisation, a dedicated consultation page on the Attorney-General Department website about the type of situations that are arising that we might need to think about how we can fix in the near future. I just also note, for the benefit of the House, that we're going to allocate an additional $42 million to the Fair Work Ombudsman to continually improve and ramp up this information delivery system. And I can say I think that that information is not going to merely be of the traditional type of what is the status of a decision and the lawfulness of a decision and how it relates to the law, but it will extend short of legal advice into the sort of things where we're answering questions like what can we do or what we should be doing in certain circumstances. As to the issue of flexibility, I think it's fair to say that the Fair Work Act wasn't designed with this challenge in mind, but there are provisions in the Fair Work Act which would allow for a modification of award with respect to extraordinary circumstances. Well, those extraordinary circumstances are here. Business and unions are doing a great job at the moment about trying to reach agreement. And if I can just give one example, an example that was put to me with respect to a modern ward. If you could modify the time and attendance record-keeping obligations in a modern award, that could save jobs, because many of them aren't coping with the fact that we are now needing to have people work from home. Some very important meetings are occurring now between senior union leaders who have been fantastic, senior business leaders who have been fantastic, to see if they can reach agreement around the types of things and specific awards that we might be able to modify through existing processes provided for in the Act to save jobs. They are cooperating like they have never cooperated before. They're cooperating like jobs depend on that cooperation, because they do, and I look forward to further cooperation from members opposite.
The member for Gorton.
Thank you, Mr Speaker. My question is to the Prime Minister.
In response to COVID-19, other countries are providing wage subsidies up to 80%. The Australian government hasn't guaranteed any worker will benefit from a wage subsidy, and for a worker on a median wage, that subsidy could be just 20%. How will the government guarantee employers are able to keep workers on during this crisis with only a 20% wage subsidy?
The Prime Minister has the floor.
Thank you, Mr Speaker. I thank the member for his question. The government has designed measures to support the situation in Australia. There are many different responses all around the country. What we are seeking to do are two things. First is to ensure that we can keep businesses as viable as possible, particularly under the rather stringent conditions we're asking businesses to operate under. Secondly, we are working to ensure that those who do have loss to their income, those who do lose their job, those who are stood down, those sole traders that can't earn what they did before, can get access to a strengthened safety net to support them through the many months that are ahead. There will be massive changes in our economy. We want to ensure that businesses can still be there on the other side so they can do two things: keep Australians employed for as long as possible, and secondly, if they're unable to do that, be in a position to re-employ them on the other side. This is the approach the government is taking. This is also the advice that we've received from Treasury. The issues in the United Kingdom were considered. Our Treasury actually recommended against us taking those measures, and I think that was sound advice. The measures as they're being designed in the United Kingdom require a complete redesign of delivery mechanisms, which will take many months. And they aren't immune from the sort of integrity issues that sadly and inevitably follow poorly designed measures. Now, I trust and I hope they get it right. But what I'm endeavouring to do is that if you find yourself in a position where you've lost income, where you've lost your job, or you're a sole trader, then we'll ensure that we get the safety net to you. And if we need to further enhance or strengthen these safety net provisions, then we will. But this is a safety net for all Australians. All Australians, whether they run a small business, or whether they're a casual employee, whether they're an employee themselves, a permanent or part-time, or whatever condition they find themselves in, we are seeking to strengthen the safety net for you and your family. It is not just the doubling, effectively, of the job seeker payment, but it is also the many other payments, whether it's family tax benefit or rental assistance or the many other supplements that exist within the automatic stabilisers of our system. We should have confidence that the social security system in Australia is one of the most targeted and most extensive anywhere in the world. It is built to ensure that when shocks hit like this, more and more Australians, particularly those who'd be most vulnerable, will be supported. So whether you're on a higher wage or you're on a lower wage, if you find yourself in a position where you're no longer in a job, we want to give you that support and ensure that we can support you and your family through what will be a very difficult next 6 months at the very least.
The member for Reid.
Thank you, Mr Speaker. My question is to the Minister for Industry, Science and Technology. Will the Minister outline to the House how the Morrison government is working to support supply chain confidence during this very challenging time?
The Minister for Industry, Science and Technology.
Thank you, Mr Speaker, and I thank the member for her question. Mr Speaker, the coronavirus is challenging Australia and the rest of the world on so many fronts. That includes an unprecedented demand for food, for medicines and vital equipment at this time. But I want to assure the Australian people that our supply chains are working well, they are functioning well, they remain open. And I say that because I want to assure the Australian people that there is no need for them to panic buy, there is no need for them to hoard, particularly food and medicines. When it comes to food, we can produce enough food for 75 million people, 3 times the population of Australia. And our food manufacturing sector has grown every quarter for the past 4 years, so it's thriving. We produce significant amounts of food, so there's nothing for Australians to be concerned about. I understand that it's alarming when you go into the supermarket and you don't see food on the shelves, but that is a restocking issue rather than a supply issue. So rest assured, that we do have sufficient supply. We also have sufficient supply of medicines here in this country. So again, there is no reason for you to have to panic buy and to hoard your medicines. Now, there have already been debates here today about personal protective equipment. So I might take the remaining time to just add to my answer previously, particularly in relation to manufacturing of personal protective equipment. Now, we have gone out with a request for information quite broadly across Australia so that we can bring out as many manufacturers as we currently as we can with regards to those who are capable and are currently producing personal protective equipment and those that have the capacity to retool and to start producing those products. I do want to speak about one of the businesses that we are currently helping, that is Medcon, which is a manufacturer of surgical masks based just outside Shepparton. They have already doubled their manufacturing capacity of surgical masks and continue to do so with the support over the short term of the Australian Defence Forces. In relation to hand sanitisers, which is something again that people are starting to see is not on the shelves, what I can say is that production is fine. Ego Pharmaceuticals that make Aquarium sanitisers, they are now producing 90,000 bottles a day, 5 times their forecast levels, so you will start to see hand sanitisers back on shelves very soon.
The Deputy Leader of the Opposition.
Thank you, Mr Speaker. My question is to the Prime Minister and it concerns the critical importance of education. Will the government guarantee resources to ensure all students who can't attend school during the COVID-19 crisis won't miss out on learning opportunities?
The Prime Minister has the call.
Well, I thank the member for his question. This is a matter that has focused a lot of my attention. This coronavirus crisis will take many things from this country, and one of the things I'm determined that it will not take is a year of learning for our children. And this has been a keen focus of the discussions of the National Cabinet, Ministers of Education at a state level and of course here, and I acknowledge the Minister for Education here as well. The arrangements that were put in place by the National Cabinet last night were that schools should remain open, and the advice says very clearly AHPPC does not support closure of schools at this time. There is no health reason, they advise, for schools to be closed or for children not to go to schools. I want to make that very clear. Your children are safe to go to school on the basis of the medical advice that has been provided to the National Cabinet. 2 arrangements are being put in place for those students. Students can present at school and undergo their normal learning in classrooms in the way that is conducted. The other way that many schools are looking at are to provide distance learning opportunities for those students who are at home. Now, whether parents choose for their children to go to school or remain at home, the children must be learning in either place, and that is the absolute position of our government in supporting the states and territories under the existing funding arrangements that we have. I agree with those who've said this. Teachers are not childminders, they're teachers. I want kids to go to school to learn and to be taught, not to be minded, and I want them to have classes in those places. And I know that they are best positioned to learn when they go into a learning environment like that. And we must sustain this for as long as is possible, subject to the health advice. And that's why I have urged that we take the position to ensure that schools remain open subject to that health advice. Now, I want to thank the teachers. And I want to thank everyone who works in the school communities, the principals and others who have been under enormous pressure based on the various positions that have been commentated on around the country. They are making the best decisions they can, and I know they're putting their students first and their education. I want to assure parents that we are doing exactly the same thing, and we're going to be working closely with state and territory governments to ensure that children's education is protected, whether it's an early childhood education. You don't get to be 4 years old in another year. That year of your learning is very important, whether you're 4 or 6 or 10 or 16. And I'd also say to parents who choose to keep their children at home, they are home for the purpose of learning. They are not home for the purpose of just running around and doing whatever they like. The decision to take people home from school and to keep them at home is intended for them to continue their learning at home. And I would encourage parents to take the responsibility of that decision, as every parent has to, very seriously.
The member for Barara.
Mr Speaker, my question is to the Prime Minister. Prime Minister, the coronavirus pandemic is changing the way we live and challenging us in ways we haven't experienced in almost a century. Would you please inform the House how meeting this challenge will require all Australians to do their duty as public citizens so we can get through this and emerge as strong, safe and united on the other side?
The Prime Minister has the call.
Well, thank you, Mr Speaker, and I thank the member for Barara for his question. And I thank all members of this place, and I thank all the staff of the members of this place for the incredible job they are doing in providing support to their local communities at this very difficult time and disseminating information as best as they can to their communities. I thank my own electorate office staff back in Cronulla, who are doing exactly the same thing as every member's office is doing here. There are so many people putting in an extraordinary effort. I thank again the members of the National Cabinet, all the premiers and chief ministers, and all of those who are working as part of their governments to make difficult decisions and get the best possible information to make those decisions. I thank the opposition for their cooperation in this chamber here as we work to ensure the parliament continues to function, that our democracy continues to operate, Mr Speaker, and to ensure that it can support the various measures and supports that are necessary to see Australia through this very difficult crisis. I want to thank all of those more broadly in the public service, at federal and state levels, the nurses, the doctors, the border force officials, the police officers, the Centrelink staff, the teachers, the bus drivers and so many more. Even those who are preparing the myriad of pieces of legislation which are on this text over in the Department of Finance and Treasury and others, completing that at some 2 a.m. or 3 a.m. in the course of Saturday evening. Everyone is working hard in the benefit of the Australian people and the national service that they are all engaged in. I thank those who are able to keep going to work and keep doing their jobs and service their communities in the private sector. I thank the employers who are keeping people in jobs for as long as they possibly can, and on the other side, if they're unable to do that, they know that they will want to stand those staff up again and they'll want to put them back on their payrolls and they'll want to put them back into those jobs when we build that bridge and we get to the other side of the recovery. Mr Speaker, I also want to thank those in the financial sector and the work that they have done with the Treasurer and others to ensure that that lifeline of credit, so important in an economic crisis, continues to be extended, and the waivers that are provided on payments and fees and interest and other things that relieve the burden. The energy companies who have also come to the aid of the nation and are providing the same sort of relief. We are in this together, Mr Speaker, and it's a national effort in which all Australians and all arms, all sections, all institutions of our country are enlisted to work together to take the actions we need to bring all Australians through. But importantly, it is at the most personal level, the interactions with each other, with our families, with our communities, where we'll be called on most. And through this, together, we will make it to the other side. And I ask that further questions be placed on the notice paper. Thank you, Mr Speaker.
The Leader of the Opposition on indulgence.